And one of those out on the front lines as well is Dr. Nicole Thomas-Sealey, a family medicine physician for Advantage Care Physicians. Thank you so much for being with us here tonight and making the time, and for what you've been doing throughout all of this.
Thank you so much for having me tonight. I really appreciate it.
And, you know, we've been doing constant updates. I want to obviously start off with really what's on top of mind, especially with parents and grandparents out there. Now it has kind of an official name to it, the multi-system inflammatory syndrome that we're seeing in different children and kids. Mayor Bill de Blasio today saying we have 145 cases of this in the 5 boroughs. 67 of those kids did test positive for COVID-19 or have the antibodies. So, doctor, have you personally seen any of these cases yet at Advantage Care where you're at? And what do parents and grandparents watching tonight need to keep in mind about this?
Hi, I think we are full alert of MISC, multi-system inflammatory syndrome at Advantage Care Physicians. Our pediatric population, as you know, is very fragile, needs special attention. And we haven't seen specific cases at our organization, but we're on high alert for it, looking for those symptoms like fever that is persistent, rash, abdominal pain, those things that are progressive, that are not getting better and are similar to diseases like Kawasaki's disease or toxic shock syndrome. So parents should be on the lookout for those things.
And that's super helpful, again, just for breaking down, because it's been a stressful time, obviously, and we did think kids were safe from this, and now we're just seeing this really strong connection. So, you know, we're just trying to obviously talk about it. We have been talking about it here on News 12 for the past week or so, but it's always good to hear from you, again, what those parents need to be looking out for, and it seems that they're pretty obvious signs. You know, of course, a fever that's not going away, you're going to want to call your doctor anyway.
Right.
So we're all on high alert, and thank you again for breaking that down. We're also getting some updated numbers from the city's Department of Health on just specific neighborhoods that have been hit the hardest by COVID-19. And we've known, you know, the Bronx, Brooklyn, parts of Queens have really felt the brunt of this pandemic. But now, you know, specifically with these updated numbers, Northeast Bronx has the highest case rate in the city. Canarsie and Flatlands in Brooklyn has the highest death rate. Obviously, a lot of factors involved in that. But in your view, you know, what still needs to be done in areas across the city to make sure that they continue to be safe? And as we move in, you know, months and months go along, especially when the fall comes and winter, everyone's scared about a second wave possibly. You know, what in your view still needs to be done in certain areas of the city to make sure people stay healthy?
Right, you bring up a great point, and I think I want to make sure, I tell my patients all the time at my office, do not relax. This is not the time when the weather gets warm to feel comfortable, to let down some of the things that have been set in place. Hand washing, wear that mask. I want to see those masks on all my patients when you're going out into the public, making sure you're protecting yourself, making sure you're protecting your neighbor. If you have a great relationship with your provider, like many of the providers that Advantage Care Physician does, then you want to make sure that you connect with them so you can talk about, through a virtual visit, hopefully, or an in-office visit if possible, to discuss diagnostic testing, to discuss antibody testing, what is appropriate for you as a patient. Make sure you access that care that's available to you at this given time. It's so important to keep those numbers down and understand how you can do your part.
Great advice, and we need to just keep all of that in mind. It was another beautiful weekend, starting to see people just try to enjoy that outdoor time, but as you said, none of this stuff, you know, can go away. We've done all the work up until this point. We got to keep it going. So thank you for those reminders. We do get a lot of social media questions, so I do want to get to some of those before we get to our callers for tonight. So I want to bring up this one from Facebook, from Jessica, who wrote, how long does an antibody test take to get the results? A lot of people trying to plan on getting those tests.
Right, that's a great question. So Advantage Care Physicians, when we are able to do that test, the serology testing, we're getting it back between 3 to 5 days. Understanding that it depends on the load of the lab that you're working with, how quickly they're able to process, but 3 to 5 days is the average speed that you'll get a result back.
That's definitely what I'm hearing. And even when I got mine done, they obviously told me 3 to 5 days, but then I ended up getting the email after 2 days. So even during a weekend. So surprisingly, you know, sometimes goes faster. But again, just allow that time, especially when you're going in, just make that mental note. And I do want to get to another social media question regarding just getting testing in general. Let's go to Rosa's comment or question if we can, because she's asking, can we possibly get tested at home for people who might be dealing with severe anxiety or something like that, or someone who has been in quarantine? So is there an at-home test option yet?
That's a great question, and I think they're developing them now. There's some lab sites that have nasal swabs that you can do at home. There's a lot of restrictions to that, and they're being developed. So I think more to come. We're looking at things that are less invasive, doing the nasal versus the nasal pharyngeal. That could be a little more uncomfortable for patients. But I think it's going to eventually be the wave because of the fear of coming into the office, and to increase testing, which is the most important thing. Any technology that helps improve testing capabilities, I'm sure the research is going to keep pushing those things.
Great point, and you're right. Let's get to Suri, who's on the line over in Borough Park. Suri, how are you?
Good, thank you.
Good.
Thank you.
What's your question for the doctor?
My question is, the first week of February, I had all the symptoms of corona, the diarrhea, I had temperature, and I had no energy. It lasted for maybe a week and a half. And then it took time, but by 3 weeks I was fine. My question is, I just went 3 days ago and I got a blood test to see if I had the antibodies, and it tested negative. So I keep thinking in my head, since it's been like 3 months, I know there's not so much known about it, but is it possible that I could have had it and just don't have antibodies anymore?
Good question.
That's a really, really good question. And I think we're going to see that a lot. So with the antibodies, the issue with the test is we do not know as a medical community if every person who's been infected with COVID-19 will develop antibodies. So it's very likely that you may have had the COVID-19 disease, and after 3 weeks, 6 months, we don't know if you're going to develop it, if your body actually developed the proteins that help fight off that infection. So that is the issue. But we're hopeful that as time goes and these tests are developed more, we will be able to go back and strengthen the ability of these tests to pick up that immunity for patients. Some people will never develop immunity, and that has happened not just with COVID-19, but other viruses also. So more to come on that with that antibody testing.
So interesting, though, Suri, because I feel like a lot of people are in that boat, too. It's such a mental thing that COVID-19 has been, too. I mean, it's mentally affected and made us aware of certain things, or obviously with fear, too, and heading outside and being around other people. But also, if you felt sick, there's so many people now that are going to get these tests just assuming, oh, well, it had to have been, you know? Okay. So when you get that negative back, it's a relief, but then it's also like, well, that's weird, you know, especially feeling all those symptoms. So, sorry, I know people are in that same boat, but again, we're just learning so much, and all these people getting tested, just like you, are going to help in that research and data. So, thanks for calling in and checking in. Let's get quickly to Dorothy over in Flatlands. Dorothy, can you hear us?
Yes, I'm here.
How are you doing?
Fine, thank you.
Good. What's your question?
My question is about this drug that I see Donald Trump has taken it for a week or so today. Hydroxychloroquine. Okay, so he had mentioned drug before, a month or so before, and they said this drug was not safe or wasn't tested. So why is it that there's a controversy saying it's safe, and why isn't it more popular? You know, why are we not getting more information about this drug? And is it safe? And will they start to give it to the general population?
Yeah.
Hi, Dorothy. That's a great question, and I can totally understand your confusion. I think in the very beginning of COVID, we were kind of grasping for straws, trying to understand what drugs that would be helpful. And hydroxychloroquine was in there, but in the later days, now that we've looked at it, we realize that it's not a drug that we're going to be using for COVID-19 treatment. So right now, unless you're in a very severe situation, experimental situation, hydroxychloroquine is not recommended.
Got another question a lot of people have been asking, especially since the president spoke about it. So, Dorothy, thank you for calling in and asking that. We're going to be right back. Stay with us. Well, joining us on Monday night's coronavirus call-in show was Dr. Nicole Thomas-Sealey, a family medicine physician for Advantage Care Physicians. And she took so many of your questions, and including a question about getting a quick cut from a barber at your home or even outside during this pandemic.
So would wait until we're off pause and that everybody has the green light to open up their shops. I would also verify that that barbershop has a lot of safety measures in place. I mean, it's the person right next to you who's the risk. The outside is just a background. Right. But if that person has something and they're not practicing safe measures, then you still have the risk. And so we have to be very careful in this moment.